Rheumatic diseases affect more than 1 in 4 adults in the U.S., yet they're often misunderstood or overlooked. Well, here to share more during Rheumatology and Rheumatic Awareness Month is Dr. Jennifer Murphy, physician with Low Country Rheumatology. I'm so happy that we're talking about this subject. I've recently come across various reels and stories on social media about some high-profile people that ended up getting diagnosed with one of the conditions that falls under that umbrella, but it took them such a long time to get to that diagnosis. Let's start here. Can you define what rheumatology is?
Sure.
And what it affects?
So rheumatology is a specialty in medicine that deals with autoimmune conditions. We all have an immune system, and our immune system should be defending us from foreigners like bacteria and viruses, but in these conditions the immune system gets confused and it starts attacking our own tissue instead of only the foreigners. And so it can present in a lot of different ways. It can affect the joints, causing joint pain or swelling. It can present with rashes. It can affect the organs, and that's where we kind of sit down and look at everything together to evaluate patients to come to a diagnosis that would be a rheumatic condition.
Goodness, I don't think enough people realize that rheumatic conditions can affect not just your internal organs, skeletal, but dermatological. I mean, it really affects the entire body in one way or the other. Is it hereditary?
It can be hereditary.
Okay.
So we see that the genetics of it imply that, or are thought to be, that the immune system not staying on track can be passed down through family members. It's not like a direct brown eye, blue eye, you know, that typical, but there is a slight increased risk if you have a relative with an autoimmune condition that you may develop one as well.
I see, I see. So how do you then recognize the symptoms? Because there's several conditions that fall within that umbrella, and maybe you could go through a few of them.
Sure. At Low Country Rheumatology, we see a lot of rheumatoid arthritis, psoriatic arthritis, systemic lupus erythematous, an autoimmune condition called Sjogren's syndrome.
Yeah, what is that?
That is when the immune system attacks the glands that produce saliva and the glands that produce tears to lead to dryness to the eyes and the mouth.
Oh, wow.
So,
So different from inflamed joints.
Yes, well,
rheumatological.
you can have joint involvement as well.
Oh,
so again, these are really systemic conditions, and that's why it's very important to sit down with the rheumatologist and have us review everything to see if we can connect dots to make that diagnosis, because a lot of people have dry eyes and that does not necessarily mean you have an autoimmune condition.
Right.
So, but that's where our expertise lies.
Is it more common in men versus women, certain age groups? When can it occur?
So autoimmune condition can happen at any time. It is more common in women than men. I'm not sure that they fully understand why, but there is not an age where you are out of the proverbial woods, you know, to getting something.
I see. So as soon as you start seeing symptoms, I mean, it sounds like a lot of people in these high-profile cases that I've read about, it took a really long time for them to realize that something was wrong. So they had these ongoing symptoms and they thought, oh, maybe I'm just sore, or I'm not exercising enough, or too much, or, you know, it comes and it goes.
Yeah.
So by the time they actually see a rheumatologist, do they understand that they actually have one of these conditions that you mentioned?
Well, and unfortunately, it's not uncommon for patients to see a couple of physicians before they're referred to a rheumatologist. And I can't speak to that case, you know.
They're all different.
They're all different. But that's why it is important to talk to your primary care doctor, and especially if you have autoimmune conditions in your family, to discuss whether a rheumatology evaluation would be warranted.
Because you also say that many of these are invisible diseases, so it might not be obvious until it really starts to affect your day-to-day functioning.
Yeah, I think it depends on the disease, because rheumatoid arthritis can be pretty, I mean, swollen hands and wrists, and that's not going to be as invisible. When the organs are involved, sometimes that can be a little bit less apparent.
Is there one test that diagnoses you, or is it just a series of everything taken into account?
Yeah, so that's the hard part. There is not one test for each disease.
Right.
It's a matter of sitting down with a rheumatologist and kind of going over the symptoms, the length of the symptoms, the family history, doing physical exams, ordering labs, possibly imaging studies, and really taking everything together to really land on that diagnosis.
Finally, treatment. So how are treatments for these various diseases? Again, they're so very different from one another, but are they showing positive results? And
yes,
are there advances?
I mean,
or there things?
It's amazing what we've been able to accomplish in rheumatology just in the last 20 years.
Oh,
there have been great medicines that basically halt the progression of rheumatoid arthritis and prevent the deformities that unfortunately were all too common back 30 years ago. So these medicines are aimed to try and help the symptoms and also prevent disease progression and or damage that would affect somebody down the road.
Yeah, all right, very good. And any upcoming breakthroughs in science that you're hearing about that might be worth mentioning?
Well, we're involved in clinical trials, so there are always new medications that are coming out. All of the recommendations and treatment plans that we come up with are individualized and based on evidence that has come through clinical trials.
Right.
So even if there is not something that has worked for someone in the past, that's the wonders of medicine. There's always something new down the road.
Indeed.
So.
Well, Dr. Murphy, thank you so much for sharing with us.
Yeah,
Appreciate
thank
it.
you.
We'll be back in 2 minutes.